Hey everybody, Dr. Butch Sonnier coming to you live from our Baton Rouge location at Sonnier Chiropractic Clinic. I hope everybody's having a great Wednesday, and I wanted to take some time out of your busy schedule to go over some of the things that we're doing here at the clinic that allow us to help so many people. But before we get started, today is a very special day today because 13 years ago today, my oldest son Barrett was born, and I have a teenager in the house, so God help me. Now I know what my dad said. He said, son, wait till it's your turn. Well, it's here now, so Barrett, have a great day, buddy. It's 2016. Everybody knows what chiropractic is. If you ask somebody, they can tell you, go see this chiropractor, go see that chiropractor. So I don't want to talk about chiropractic today. What I want to do is talk about some of the things we do here in the office that allow the chiropractic adjustment to work that much more effectively. And when you come see me at my office, we're going to evaluate you, we're going to render a diagnosis, and if that problem that we're treating you for falls into a window of what a chiropractor can do to help you, yes, we're going to adjust your spine, which is the most powerful thing that any chiropractor can do. But along the way, we may utilize some additional treatments that allow the chiropractic adjustment to work that much more effectively. One of the things we're going to talk about that we do here in the office is dry needling. Dry needling is all the rage. You know, people talk about it everywhere. And when people find out that I performed the procedure here in the office, they're kind of taken aback and they're a little surprised, and they ask me all kinds of questions regarding dry needling, what it is. So I wanted to hit on a few of those questions and the bullet points to maybe give you a little bit more information about the procedure. So the first one is, why is it called dry needling? Well, we use solid gauge needles in the procedure, which means no liquid can pass through it. So hence the name, a dry needle. The alternative is when you go see your medical doctor and you get an injection, the needle has to be hollow so the fluid, the medication, can pass through the needle, hence the name, a wet needle. So that's why it's called dry needling. Is dry needling acupuncture? No, not acupuncture at all. The only similarities we share with acupuncture is we use the same needles. That's where it ends. Acupuncture is a primary treatment philosophy that is utilized to treat X. You go see a chiropractor who utilizes the adjustment to treat X. Dry needling is a modality that allows the primary treatment philosophy to work better, in our case chiropractic. So what kind of conditions do we treat with dry needling? Well, we treat muscle related conditions. A lot of sports related injuries. A lot of people don't know I am the team chiropractor for the Southeastern Louisiana University track team. And in the spring track season, we work on a lot of their athletes. A lot of football related injuries, runners, cyclists, we treat all kinds of injuries like that. Also contusion based injuries that occur to muscles that may occur from everything from falling out of a tree stand during deer season to falling off a ladder or even car wrecks. If there is a muscle related injury, the needling procedure helps those muscles recover a lot more quickly. How does that work? Well, we use the needles, and the needles, by the way, are very, very small. You practically don't feel them when they're inserted, and that's one of the main questions, does it hurt? And the answer is no. Because the needles are so small, you don't even feel them. Needles are inserted into the muscle. The depth and the area of the muscle that we're utilizing and working depends on the condition that you're being treated for. So the needle goes in, needle comes out, needle goes in, needle comes out. We do multiple insertions, and what that effectively does is reduce trigger points, reduces muscle spasms that effectively help pain relief so you feel better, and it also improves range of motion, which again helps the chiropractic adjustment work that much more effectively. Is it covered by insurance? That's one of the most common questions we're asked. Well, if your insurance policy covers chiropractic, then majority of the time they will cover the dry needling procedures as well. What are the ages of some of the patients that we needle? The youngest patients I've needled has been 12 years old. Actually, it was my son. He twisted his ankle playing football. We used procedures on his ankle, helped him get over the problem that much more quickly, all the way up to people in their 80s. So it's a wide variety of people that we can help. Do you have to be a patient of the clinic? Well, yes, you do. Do we have to adjust you while you're being needled? Well, needling works well on its own, but you're going to get a better result a lot of times if we utilize the adjustment as well. So hopefully that gives you a little information about the needling, what it is and how it works. If it's something you think we can help you with, please give us a call at 766-2952, or please check us out on our website at sonchiro.com. Hope you have a great Wednesday. Thanks a lot for tuning in.